Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Cardiac Rehabilitation. Introduction. Experiencing heart disease should be the beginning of a new, healthier lifestyle. Cardiac rehabilitation helps you in two ways. First, it helps your heart recover from heart disease through exercise programs. Second, it provides you with information about lifestyle changes that can result in a healthier heart. This program summarizes some of the information that is presented to you during your cardiac rehabilitation program. The heart. The heart is the most important muscle in the body. It continuously pumps blood throughout the body. Blood carries nutrients and oxygen. The heart also needs nutrients and oxygen. The heart pumps blood to itself through arteries. The arteries that supply blood to the heart are called coronary arteries. Narrowing of the coronary arteries. Healthy coronary arteries have smooth linings, allowing blood to flow smoothly. This is a normal artery. High blood pressure can cause damage to the lining of the coronary arteries. The damage makes the lining rough. Fatty substances, such as cholesterol, can stick to the rough lining and collect in the arteries. As a result, plaque is formed on the inner walls of the arteries. Plaque and deposits of cholesterol in the walls of the coronary arteries usually cause them to narrow. This is known as arteriosclerosis. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Angina, heart attack, and stroke. Narrowing of the arteries can lead to a decrease in blood supply to the heart. When blood flow decreases to the heart, people may feel chest pain, heaviness, and shortness of breath. This is also known as angina. The pain can sometimes be located in the stomach area, the middle of the back, the left arm, or the jaw. When the narrowing is severe enough, blood flow may be totally blocked. This causes a heart attack. During a heart attack, the part of the heart that does not receive blood dies. The heart will then have difficulty in pumping blood to the rest of the body. A heart attack may occur without any exertion. Its symptoms are similar to those of angina. Sometimes a piece of plaque from a narrowed artery can detach and move up to an artery in the brain. It blocks the artery and stops the blood supply to that part of the brain. This is known as a brain attack or a stroke. A stroke could lead to a coma or death. The signs of a stroke include the following. 1. A sudden numbness or weakness of the face, arm, or leg, especially on one side of the body. 2. Sudden confusion, trouble speaking or understanding. 3. Sudden trouble seeing in one or both eyes. 4. Difficulty walking, dizziness, or loss of balance and coordination. 5. A severe headache with no known cause. If you see or have any of these symptoms, call 911. Treatment can be more effective if given quickly. Every minute counts. Fortunately, lifestyle changes can prevent further damage to the coronary arteries and lower your risk of having a stroke. A cardiac rehabilitation program will help you understand and prevent coronary artery diseases. Monitored exercise. Exercising under your physician's supervision improves the functions of your heart. During cardiac rehabilitation, your exercise program will gradually increase in difficulty based on your progress. You may be asked to use a heart monitor to measure your heart rate during exercise. Patients who had heart surgery may feel discomfort from the incision during exercise. They need to learn to distinguish this discomfort from other pain caused by overexertion. You should slow down and notify your doctor or care manager if you feel heart palpitations, dizziness, nausea, excessive fatigue, chest pain. Preventing coronary artery disease. Your cardiac care manager will explain and answer questions about risk factors for coronary artery disease. A risk factor is something that increases your chance of having heart disease. Fortunately, you can control many of the factors that contribute to the narrowing of the coronary arteries. The major risk factors for arteriosclerosis are 1. High cholesterol, 2. High blood pressure, 3. Smoking, 4. Lack of exercise, 5. Stress, 6. Obesity, 7. Diabetes. The following sections will explain how you can prevent coronary artery disease through diet, exercise, and avoiding risky behaviors. Eating healthy. Sticking to a healthy and balanced diet can improve the health of your heart and blood vessels. Eat more fruits and vegetables and limit processed foods. Processed foods include baked goods such as chips, cookies, and snack cakes. Processed foods often contain a lot of sugar, salt, harmful fats, and extra calories. Replace saturated and trans fat with unsaturated fat. Saturated fats are present in red meats and dairy products, such as whole milk products, butter, and cheeses. Unsaturated fats are found in fatty fish, such as salmon, nuts, avocados, olive oil, and vegetable oils. Avoid fried foods. Fried food generally has more saturated and trans fat than grilled or broiled foods. Controlling blood pressure. High blood pressure, also called hypertension, contributes to the narrowing of the blood vessels of the heart, brain, and kidneys. It can lead to heart attacks, strokes, and kidney failure. Patients with high blood pressure should limit their salt intake. Salt tends to increase blood pressure, which increases the chance of narrowing of the arteries. There are many salt substitutes that can provide excellent taste without harmful salt. You should have your doctor's okay to use a salt substitute. Hypertension may not have any symptoms. It is important to have your blood pressure checked frequently. Quitting smoking. Smoking is a major risk factor causing heart disease, as well as lung cancer, emphysema, and strokes. Quitting is difficult. Fortunately, many programs have been developed to help you stop smoking. Your cardiac care manager will work with you to help you stop smoking. Exercising. Exercising leads to weight loss, which may lower your total cholesterol levels and blood pressure. Your cardiac care manager will help you build a fitness program into your daily or weekly schedule to help you continue to exercise on a regular basis. Obesity. Obesity can also contribute to heart disease, as well as diabetes and hypertension. A well-balanced diet and exercise can help you lose unwanted pounds. Losing weight should be done slowly, not in a crash diet. For example, it is better to lose 20 pounds in a year and keep it off than lose weight very quickly and gain it back. Your cardiac rehabilitation specialist and nutritionist can help you achieve this goal. However, it is up to you to implement it. Knowing your other risk factors. Other risk factors can also contribute to heart disease. Family history of heart disease increases a person's chance of having heart problems. People with diabetes also have a higher risk of having heart diseases. Diabetes is a disease where the body is unable to handle sugar adequately in the blood, causing a rise in blood sugar levels. The causes of diabetes are not known. However, by knowing that it is a risk factor for narrowing of the coronary arteries, you can diagnose it early and control it. Diabetes can be controlled through diet, medication, exercise, and weight loss. In addition to lifestyle changes, the right combination of medications can lower your risk of future heart attacks and strokes. Vasodilators, which lower blood pressure by causing the blood vessels to relax and widen. Aspirin, which reduces the chances of the blood forming clots. Statins, which lower your LDL, the bad cholesterol, which can build up in your arteries. Beta blockers, which relax the heart muscle and allows the heart to pump more easily. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. Experiencing a heart attack or having heart problems should be the beginning of a new, healthier lifestyle. The key to a healthier lifestyle is eating healthy, exercising, quitting smoking, and relieving stress. These lifestyle changes are necessary to help prevent further heart problems. It is easier to make these changes with the help of family members, friends, or support groups. Your cardiac rehabilitation support team is also available to answer your questions and to plan exercise and diet programs that fit your needs. Thank you for using Explain.